Everyone. Happy Valentine's Day. Looks like we got Facebook up and running and YouTube. So let me know if you can hear me okay. You can see me okay. Looks like Instagram is lagging for some reason. And so it is what it is. Sorry, guys, if they're on that channel, you're having difficulty. We've been having some trouble with it. So we'll see if that gets going or not. So let me know if you guys are there. Let me know if you're on. Happy Valentine's everyone. So tonight's topic is Amanda says loud and clear. Hi, Amanda. Thank you. So tonight's topic is let's talk about, and then Amanda, you had posted the song "Let's Talk About Sex, Baby." Let's talk about you and me. Yep, Mary. Let's talk about all the good times and the bad times that may be. So some of you guys that were around in the 90s know that song. You guys can play a little trivia on what year did that song come out. So Amanda knows exactly that song. Those of you that listen, Gina knows exactly that song. Some of you guys probably just sang with me. And so I figured a fitting topic for this Valentine's Day is let's talk about the act. And Leah wants me to let you know it is Rio's birthday. So we adopted Rio, our dog, from Puerto Rico by way of Miami. And he was one of 9 in the litter, and his birthday is around this part. So we picked Valentine's Day because it's easy to remember.
No, we picked something near Valentine's Day, and then we forgot that, and we picked Valentine's.
Okay. So he's 5. So Leah wanted us to tell you that, wanted me to tell you it is our dog's birthday today. So anyway, so I figured with the Valentine's Day that this would be a timely topic. Now, this is going to be a little bit over PG material. So if you have young ears around, I will keep it as PG as possible, but it's probably more on the PG-13 topic. So just a heads up if you have kids around. So I realize as a country that we do not, women to women, we do not really speak about this topic very much as far as, hey, Mia, as far as really like American women, and maybe, if you're from a different country, maybe you can shed, I don't like that saying anymore, shed some light. I don't, that's not a good saying lately. Maybe you can shed some light on this. So like I grew up in Miami. I grew up in an international city, and I would say that it was pretty up to date on things. Now, I'm not, I wouldn't say I'm so up to date with things anymore because I don't watch the news. I don't watch mainstream media. I don't go to movies. And I have patients. You realize you're not hip anymore. Hey, Jen, when your patients come in and they say sayings and you're like, I don't even know what you're talking about. I don't even know what that word is anymore, right? And so I think as a country, female to female, we don't have appropriate discussions on this topic. I think male to male, and so my background, I started working with athletes in high school as a student athletic trainer. My work in high school in Miami with the high school football team got me, or I earned a scholarship in college at the University of Florida to work in the men's football training room, which back then, this was in the 90s, women were just allowed in it. It sounds like ancient history, but they're like, we finally let women in the men's training room. I'm like, what century are we in again? Should I go pull the cotton out of the field, Paul? Like, it just sounded so weird. Sorry, Instagram people, we're having some issues here, so I'm just going to end this feed. And so I just, never had trouble with the opposite sex. I worked in a male-dominated field with football. I was telling a patient this, one of my first things that I had to do as a student athletic trainer at the University of Florida is there was a male athlete that pulled a muscle in his gluteus. And he was a linebacker, so he was a big dude. And they said, Lisa, do you know how to do ultrasound? And I said, yes, I do. And they said, okay, so I want you to do ultrasound on his gluteus muscle. And I said, yes, sir. And so the football player exposed his gluteus muscle, and there's a handheld ultrasound wand. You put ultrasound gel on the head of the ultrasound unit, kind of like how you do a sonogram with a baby. And then I was ultrasounding this gluteus muscle. Those of you that are not familiar with anatomy, the gluteus muscle is located in the butt. And so I was just there doing ultrasound on his behind. And of course, the football players had tons of jokes. They said that the moon was shining brightly that day, and if I enjoyed the sight of the moon, and on and on and on and on. And so, for whatever reason, I worked a lot of men's sports from college football. After that, I worked in chiropractic school with men's soccer, men's rugby, track and field. Then when I finished chiropractic school in California, men's ice hockey. I worked professional women's soccer out there. Then I came back to Florida, worked men's semi-pro soccer, men's professional indoor soccer, women's professional soccer. And so I was always comfortable around guys. Female athletes can be very upfront as well, and it was not a big deal. But I found that women kind of don't tell other women, and definitely my mother. I love my mother, so if you watch this, I love you, Mom. But you didn't really do an amazing job in educating on this topic. She gave me a book and said, if you had questions, ask me. I'm like, you gave me a book and you taught me stuff in the book that I didn't know about, so there's that. And then this topic wasn't very well explained. Yes, in 6th grade, we had our birds and bees conversation, and they separated the boys with the girls, and they told us about periods, and they told us about male functions and stuff like that. So Amanda got the same talk, and it just was kind of wasn't very well explained. Now, I am not advocating for 3rd graders or 2nd graders in their curriculum to have these books that are out now that are describing all these things. I don't think that is a solution. But I think that if you are a female practitioner, that we have a duty to explain to our patients that there are healthy things when it regards to this topic, and there's unhealthy things in regards to this topic, and basic healthy and basic unhealthy things. For example, in a female menstrual cycle, there are different menstrual feminine products that can be utilized. Some of those feminine products have horrible chemicals that actually cause more bleeding. So if you were to utilize a product that was bleached, or is scented, you're putting chemicals into, if it's a tampon, you're putting chemicals into the vagina. The vagina is very absorbent, and we'll see what Facebook and YouTube does with this video now that I'm saying vagina, but it is very absorbent and will absorb chemicals. And so that can cause future fertility problems. That can cause problems with menstruation. It can cause heavy periods, light periods, crimping periods, the body not to ovulate properly. So there's everything when it comes to the menstruation talk. Then you have healthier feminine products that would be organic tampons or organic pads. They have right now the Diva Cup, which is a silicone cup that's inserted into the vagina. Myself personally, I don't use that. I don't think it is a good idea to store menstrual blood in the vagina. I don't really think tampons are healthy either. Did I use them as an athlete? I absolutely did. Because running around Miami on a soccer field in 98-degree weather with 80% humidity, I'm sorry to be graphic, but a pad is not going to stick. It's just going to, and actually I tried one game and it flipped over where the sticky side was up, and that was, you can imagine how horrible that was. Robin says she likes Lola tampons. Cool. So then when it comes to tonight's topic, where do you get this information? So my friends gave me information. Actually hanging out with male athletes gave me this information. But there's really not a good source and topic of this. So as a female physician, what responsibility do I have to educate patients? What responsibility do I have to educate adult patients? What responsibility do I have to tell women the truth about labor and pregnancy, right? And so I do believe as a natural healthcare provider, we do have a responsibility level, but to what extent, right? Do I start talking to a 13-year-old? Do I have permission to the parents to talk to a 13-year-old? Do I talk to an 18-year-old? Do I talk to a 20-something-year-old? Do I talk to a single woman? Do I talk to a married woman? Do I talk to a woman that hasn't had her first child? Do I talk to a woman that's had her first child but not her second? Like where, and I'd love to hear you guys' opinion. Where is it an appropriate conversation? So a couple years ago, I started Dr. Mama Bear. So you'll hear me say, hi, I'm Dr. Lisa Palmer, Dr. Mama Bear. I actually don't even know if I introduced myself today and just jumped into this topic. And part of the Mama Bear idea was to educate women and educate moms on various different topics. Well, what was interesting when I started the Mama Bear, what I called the Mama Bear Challenge, my goal with the Mama Bear Challenge was to educate on female health and periods and pregnancy and nutrition and cooking and relationships and families and stuff like that. But what ended up happening was my women that were in the Mama Bear Challenge really wanted to learn about quantum nutrition testing, which is what we do at the office to help patients rebalance their bodies to heal naturally. And the Mama Bear Challenge turned into the Quantum Nutrition Academy and went in that direction. And so if you are a mom and you do have a young daughter, would you want a course on cycles and what's normal? Because I'm learning more and more that women don't even know what a normal menstruation is. They do not understand what a female cycle should be. And because they don't understand what healthy is, they look for solutions that for symptoms of an unhealthy cycle. And unfortunately, the current solutions that are mainstream right now is birth control. So oral contraceptives, oral hormones. The problem with oral contraceptives, and you can look it up yourself, you can go to drugs.com, and you can see that the side effects of oral contraceptives are increased risks of cervical cancer, increased risks of breast cancer, increased risks of ovarian cancer, increased risks of stroke, increased rates of infertility, all these things which really are not disclosed, in my opinion, properly. So I played high school sport. I was always athletic, always outside playing, riding my bike, playing with the neighborhood boys, hide and go seek, football, riding my bike to the beach. And then in high school, in middle school, I actually tried out for the boys soccer team because we didn't have women's soccer, and I made it, but my dad didn't let me play. So in high school, I played high school soccer. I was decent enough with only a couple years of playing soccer to get recruited to play Division III soccer, which I was pretty proud of. I'm like, I didn't play soccer my whole entire life because they didn't have teams for my age range. Doesn't that sound crazy? They didn't have women's teams when I was old enough to play youth soccer. That's insane. And so why am I telling you this? Well, I had what they called athletic amenorrhea, meaning that I would skip periods. So I'd have a menstrual cycle, skip 3 months. I'd have a menstrual cycle, skip 6 months. I'd have a menstrual cycle, skip 2 months. And so it was very frustrating as a young woman to I didn't know what normal was because what I had was abnormal. And then when I went to the OBGYN and I said, look, I have a period, I skipped 3 months. I have a period, I skipped 9 months. I don't even know when I'm going to have a period. And so on one hand, it was great, especially as an athlete, because who wants to have a period in 98-degree Fahrenheit weather and 80 degrees humidity, sweating like everything. You would play soccer. My hair would be wet. My jersey would be wet. My shorts would be wet. My socks, like everything in that much humidity is soaked in sweat. So having a menstrual cycle with that kind of environment is awful. So I was happy not to have it. But then I realized that that was not healthy not to have a cycle. So I went to the OBGYN. They ran blood work. They did an exam on me, and they told me I should have nothing to complain about. Like, I'm wasting their time. I should be happy that I don't have my period because they have pills for that now. So then when I went to University of Florida, I didn't like, that was a Miami doctor, and I didn't like her answer. So I went to the school clinic because we had free healthcare. And I told the OB-GYN there, I said, look, I have this problem and I'm worried because it's not normal. And she also had a similar answer of, well, I wouldn't complain about it. You don't have to have your period. And I said, but something's wrong with me. So instead of finding the cause, she issued birth control. And I'm like, okay, well, I guess I should take this because something in my body's wrong. Like, I understood at the head point, I had taken anatomy. I took AP anatomy and physiology in high school. And so I had an understanding of how the body worked. I had taken health classes in elementary school and so on. And then I was in anatomy and physiology college level, right? And so I understood female hormones, not to the extent that I do now, but I understood it wasn't normal. And so the doctor's solution was, well, here, take these hormones. You guys can let me know if you were ever on orthotricycline. So he gave me orthotricycline. I took it and I thought, okay, good. I'm finally going to have normal cycles. I'm finally going to know when my period is. I don't have to guess. I don't have to have those oopsies. Oh, wow, I have my period now. That's not fun. And I felt horrible on the orthotricycline. My breasts increased in size. So some of you guys that are smaller breasts are like, that's cool. No, it's not cool, because when you're an athlete and you're trying to run, you don't want to have extra on the top. It made me very, very emotional. So I would just start crying for no apparent reason. That was not fun. It's a horrible feeling to know that you're being emotional, but there's no reason really to be emotional, but you can't control your emotions. It feels kind of crazy. And then I gained 20 pounds, right? Why? Because they were putting fake hormones in my body and messing. When you do that, when you take a oral contraceptive, when you take a hormone, I was just talking to a male patient today, and he's like, I think he's older. He's in his early 70s. He said, Dr. Palmer, when I took testosterone, I felt really good. What do you think about me getting testosterone injections? And I said, well, everything comes with a price. So if you're in your 70s and you don't care what effect that has and you felt amazing, then go for it. But just know it doesn't come for free, meaning that when you take testosterone, your body will make less testosterone. When you take fake hormones, it has a negative effect on your body and you will suffer the consequences. So if you're 70 and you just don't care anymore, then you don't care anymore. And that's my answer. But if you want to truly be healthy and you know that every medication that you take has a side effect, then you may reconsider what you're thinking. And so it got the patient thinking. So then I came off the orthotricycline because it made me feel horrible. And then later in life, when I started to get into holistic nutrition after my doctor chiropractic degree, I realized that when a female has imbalanced hormones, they will have premenstrual syndrome. They will have swollen breasts. They will have heavy bleeding. They will have spotting. They will have missed periods. They will have crampy periods. They will have fertility issues. So if you have those symptoms, it means there's imbalances in your hormones. Why am I talking about this? I'm talking about this because when it comes to that act, and I'm calling it that on purpose so this video doesn't get completely shut down. When it comes to the act, if you have pain, there is a reason for that. You should not have pain. If you have dryness, there's a reason for that. You shouldn't have dryness. If you're having problems with fertility, there's a reason for that. So I had a roommate in college, and she was told she'll never have kids. So she was, how do I say this? She was not careful when she had the act because she thought, well, it doesn't matter because I was told by a doctor I'll never have kids because of XYZ. Well, when you balance out the body, that's not true. You could become fertile. And so later in life, we did some nutrition work, and she did some nutrition work, and she has 2 beautiful boys now, right? So that the purpose of the act is to conceive, is to have a family. That's the purpose of that, right? And then you can get into other reasons why, and you can get into different reasons why, and that's not really the purpose of this webinar. Some of you guys would be like, well, that's the best part of this webinar. It's Valentine's Day, right? And so there's different viewpoints depending on your religion, depending on your culture, depending on how you were brought up, depending on what your girlfriends told you, depending on what your boyfriends told you. But what I wanted to share is that with that, there's healthy things and there's unhealthy things. So a lot of the chemicals that are used in that act are really bad for you. Now, with that, I get asked all the time, what is the best way for preventing future kids if you don't want to have kids? Sorry, something's making my eye itch and I'm about to sneeze. Excuse me. And so the best prevention is not to do that. And so that may work for some people, and then for other people that's a ridiculous thing to say. If you know your cycle really, really well, then there's times where you're very, very fertile, and then there's times where you're not fertile. But if your periods are irregular, that's not a good method to use. Barrier methods are good. As long as they're not broken, they should be pretty good with that, right? And then there's certain acts that are a bit more risky. There's orifices that are entrances that are meant for certain acts, and then there's entrances that are exits that are not meant for that. And so I've worked with certain patients that like to utilize the exit, and the exit is very absorbent. And so because the exit's very absorbent, they've had health issues. And I'm not calling out certain populations. I'm not making anybody wrong. I'm not trying to be whatever. I'm just letting you know that the exit is meant for exiting feces. And yeah, it's fun trying to describe this stuff in PG terms. And when it is not utilized as an exit and it's more of an entrance, there's bleeding. There is absorption. And so I've had multiple cases where the exit is used and the person is very sick and they keep getting sick because of that reason. Now, sexually transmitted diseases, you can get that from the entrance, you can get that from the exit. And so you need to be aware of what you're doing, right? You want to make healthy choices, I guess, is my point. And so there's some people that think, well, if I do these things with the act and I don't want to have kids, then I can just do this thing and not have kids. Well, one of the solutions to that in the medical world is an IUD. I have had many, many female patients have severe issues from the IUD. One of the cases recently, her kidneys were shutting down. She's going into kidney failure in her 20s, and it was IUD. I've had women have horrible cramps because of the IUD. I've had women have problems with the fertility because IUD. And recently I learned you're only supposed to have IUD for 2 years and you're never supposed to have one again. And I'm like, well, that's interesting because a lot of women have it for a really long time. I had a case where a patient was in a car accident and we did x-rays on her low back to make sure that she didn't have any fractures or breaks in her lumbar spine from the accident. And I saw this weird thing in front of her spine. And the weird thing was the IUD, and her body rejected the IUD. She didn't know, her doctor didn't know, and her body pushed the IUD outside the uterus through the uterine wall and was floating in front of her spine. I was like, oh my goodness, this is crazy, right? My mom, one of the stories. So my mom is a registered nurse. She worked for many, many years in South Florida. She worked at Jackson Memorial with immune compromised patients, dermatology, radiology, ER, so many different floors, which really is something I admired about her as a nurse, and really gave her a diverse background in her career, which I can appreciate. And so she tells a story about this baby that was being delivered, and the lady never should have delivered the baby because she had IUD. And so they wondered why she got pregnant. Well, when the baby was delivered, the baby had the IUD in the baby's hand. Isn't that insane? And the baby's like, it didn't work. So my opinion is IUDs are not a good option for birth control, because with the copper, it causes problems. With the hormones, it causes problems. And it's not a healthy option. The cases I work on, it's one of the causes of heavy periods, cramping, kidney problems, and so on. So I wanted to talk about this topic because I don't think that enough physicians are talking about it. If you're in natural health care, I don't think enough natural health care people are talking about it. If you have questions for me, go ahead and put in the chat. Something is really making my eyes itch. The pollen count in Florida is out of control, and you should be able to handle pollen. So if you have allergies to pollen, to trees, to grasses, to whatever, it could be a backed up liver, or it could be pollen counts are crazy. So if you have questions on this topic, ask me in the chat. I do encourage you, moms, to have that uncomfortable conversation, but make it comfortable, right? Like, ask your daughter if she has any questions. Ask your son if he has any questions. Make it okay to talk about topics. One of my family members said if I ever had gotten pregnant outside of marriage, they would have disowned me. That kind of messed up my head. Like, it was not a good communication. And later in life, I spoke to that person. I said, hey, when I was 18, you told me this, and that really damaged me. Like, it even affected me when my husband and I first got married, because that statement replayed in my subconscious, right? So just be aware of, what do you want your children to understand? What do you want? What do you believe in your religion? What did you do, right? So don't educate your kids in ways that you didn't comply with. Like, don't give them certain policies that you broke, right? Like, I don't think that's cool. Let them know that their choices have consequences. So if they decide to do oral contraceptives, they should watch. So Robin mentioned that there was a movie that we watched. It was The Business of Birth Control. I highly recommend that movie. And you as a parent should watch it first. And if you find that it's appropriate for your daughter to watch, your daughter should watch it. And if you find it appropriate for your son to watch it, your son could watch it. Because there are some men or young men that think that their girlfriend should be on birth control because it's convenient, but they really don't understand the side effects of birth control. And when I'm saying birth control, I'm talking about oral contraceptives, and I'm also talking about IUDs. Now, condoms are a barrier method. My opinion, either abstinence or barrier method or knowing your body. Those are the three options, but it also depends on where you are in life. Like, are you on the dating scene? Are you in college? Are you newly divorced? Are you where are you? In the state of Florida, the highest rate of sexually transmitted diseases is not our colleges. It is not our high schools. It is actually, it's kind of embarrassing to tell you guys this, but it is actually a location in Florida that is known for elderly to retire, called The Villages, have one of the highest rates, actually not one of the highest rates, has the highest rate of sexually transmitted diseases. Why? Because they believe just because they went through menopause that they don't have to be smart about what they do. And so they think, well, because they can't get pregnant, that they can do whatever they're going to do, but they're not taking responsibility for other things that can occur when you are not taking responsibility for your decisions, right? And so remember, there are some of these conditions, some of these diseases that can cause blindness, that can make you more susceptible to urinary tract infections, that can give you other kinds of infections. And so it's not okay, well, you reach a certain age, so you can do whatever you want, however you want, with whomever you want, as many times as you want. It is you still have, my opinion, a responsibility to be healthy, and a responsibility to, with your significant other, to disclose whether you are healthy or not healthy, or whether you have bacteria that can be transmitted or parasites that could be transmitted and cause problems in other people. Okay, good. So hopefully this talk has helped you guys. If you find it appropriate to share it with your I don't want to say child because that sounds wrong. With your young adult, with your high school student, with your college student, please do so. They need to know this information. They need to have sources of this information that they can share with their friends, they can share with their family. If enough people want a course on this where they get a holistic viewpoint on birth control, on the act, on starting families, I'm happy to make it. If you are currently experiencing difficulty with your female cycle, if you currently are experiencing premenstrual syndrome, if you have menopausal symptoms, if you have heavy periods, clotty periods, crampy periods, emotional periods, if you have any other symptom other than just shedding the uterine wall, then please reach out to us at Palmer Natural Health. We're located in Central Florida. We do consult with clients all over the United States, all over the world. We are here to help. Currently, we're offering a February special. It's only $120 US, and we are happy to see if there's things that we can do to help you naturally to rebalance your body so you're not suffering with these side effects. If you do have pain with the act, there's a reason for that. And no, we're not going to go down south and do an exam there, but instead we're going to utilize quantum nutrition testing. Maybe we need to work with your OBGYN, but we're going to use quantum nutrition testing to see if there's any imbalances in your system. And if there's imbalances in your system, we're going to look for why. So one reason why people have hormonal issues is they have mold in their house. I can't tell you how many cases I've worked on with a female patient that is having endometriosis, PCOS, PMS symptoms, fibroids, cysts, you name it. And it's because they're living in a moldy house. They had hurricane damage, and the hurricane caused leaks in their roof. I was driving home today, and I was driving by one of my neighbor's houses, and they have blue tarps on their roof. Do you know what blue tarps on their roof mean? It means that they had damage on their roof and they have active leaks. That is horrible. You need to get that fixed if possible, as soon as possible, because the longer that's leaking, the more mold that is entering your water that's entering your house that will cause mold issues. Mold increases estrogen in a female body, which will cause PMS, menopausal symptoms, and can lead to cancer. In a male body, it causes imbalanced hormones, low T, and can lead to cancer. So if you need our help, we are here. I wish all of you guys a happy Valentine's Day. I'm Dr. Lisa Palmer, Dr. Mama Bear. Good night, everyone. Bye.